And good afternoon, everyone, and thanks again for joining us in this, our continued dialogue on COVID-19 and its impact here in Orange County. Bringing us information and remarks in this press event today are Orange County Mayor Jerry L. Demings, Orlando Mayor Buddy Dyer, Dr. Raul Pino, Health Officer with the Florida Department of Health, and our Sheriff, Orange County Sheriff John Mina. To our members of the media, thank you once again for being here and for your coverage on this important occasion and what is happening on COVID-19, as we have requested from you in the past. As our speakers bring you their report, if you have some questions, we ask you to kindly please write them down, and during the Q&A, when that particular presenter is called up, please be ready with your questions so that questions can be asked of that presenter at one time, saving us all a bit of time and effort. All right, thank you very much, members of the media, and to our community. Starting us off today, Orange County Mayor Jerry Demings. Mayor.
Thank you, Dr. Williamson, and thank you to all of you for being here this afternoon. As we begin this update, let me just start by talking a little bit about where we are as we're into the second month or so of our response to this pandemic. You've heard different ones of us talk about, sometimes when we share the numbers, we just talk about it as if it's numbers, but really it does represent real people. And last evening, I was notified by a friend, a church member, that her husband passed recently as a result of the COVID-19 virus. And they were two just loving people, a couple that had been married for over 50 years. And he had not been sick, and for some reason, he went to the hospital, and in about a week's period of time, he passed away. And so she shared with me that although she has not been tested, she spent the last 2 weeks in self-quarantine and self-isolation by herself. Nearly 80 years old, no family members. She has a daughter that lives out of state, but was afraid to have her daughter come and visit because she didn't want to really pass the virus on to someone else. And so as I thought about that, just what would that be like if I had to just stay by myself after just having to deal with the fact that my longtime spouse died alone. And one of the things that she said to me that kind of was stuck with me was she said she was starving for just a human interaction, just a hug. And so as I start this, I remind our community about what we're trying to do. She had made a personal decision not to force the system to test her because she was asymptomatic, and she didn't want to take the test away from somebody that perhaps needed it, knowing that we have limited supplies of tests. So my prayer for her is that she'll be okay, and by all indications, because today made the 14th day for her since being exposed to her husband. She's not been able to have a funeral service for him. She's postponed that for some point into the future. And sadly, that's the reality for at least 10 families now in Orange County, thousands of families across America, and there are perhaps others who are similarly situated in our community. So that makes it real. That's the reality, if you will, of what we're dealing with. So today I report that Orange County now has 803 confirmed cases, and we know by the end of the day that number will likely go up again. A total of 96 hospitalizations and 10 deaths in our community. Dr. Pino from the Florida Department of Health in Orange County will get more into some of the data, the specifics associated with the cases. We also have an updated heat map that is here that shows where the Orange County hotspots are. I remind our community, don't get complacent with this. Whether the numbers go up or they come down, it is still a virus that is highly contagious, and it can cause you death in some cases. The zip codes here within Orange County that seem to show hotspots are 32822, 32824, 32828, and 32837. If you're not one of those zip codes that I called, we know that at least 40 or so of the zip codes out of the 53 in Orange County have at least one case. But one way to ensure that your zip code does not become a hotspot is to follow the CDC guidelines on keeping your distance from others and practicing safe sanitary protocols. There's really no substitute for that. Let me talk a little bit about the convention center site where a lot of testing has been done. I know that there have been over 8,000, 8,200 cases or so, tests that have been conducted in Orange County, and that grows each day. But the number of people we are able to test at the convention center site is anticipated to increase. So far, over 3,700 tests have been administered at that site between the state and federal officials. We are working with our region's counties to request that the Orange County Convention Center be designated as a federal medical facility site should we significantly exceed our region's hospital capacity. I participated on a joint briefing call with U.S. Senator Rick Scott within the last hour to help advance this request. Again, part of that is about planning for the worst, but hoping for the best. Today, I was told that the convention center testing site secured 350 COVID-19 collection kits or tests. The lines have been much shorter, and this site is free to the entire region. As far as personal protection equipment, PPEs, we have placed large quantity orders to the state, but we receive PPE equipment or supplies in small shipments. As we receive shipments, the priority will be to distribute the PPEs to long-term care, hospitals, public safety workers, and other first responders in Orange County based on the need. We continue to search for viable resources for personal protective equipment, but like everyone else in America and across the world, it's difficult to find supplies in adequate numbers that we can readily get access to. We are very interested, though, in local manufacturing firms who can help with producing PPEs and products such as hand sanitizer. So I'm appealing to the manufacturing firms here locally that if we can't rely on the supply chain from the federal government, then perhaps a better solution is to produce it here locally. And I know that there are local manufacturing firms that perhaps have the equipment to be able to produce it. So there's a business opportunity there to get into the business of producing what we don't have right here locally. Let me change a little bit and talk about the 407 day that occurred yesterday. In partnership with Visit Orlando, we celebrated the hashtag 407 Day on April the 7th, a date that was significant because it represented our longtime area code of 407. In honor of this unique date, we asked residents to support our local restaurants during these challenging times ordering takeout from many eateries throughout Orange County. I'm proud to say that more than 2,500 social media posts were shared regarding hashtag 407day and hashtag Orlando to go. Our positive message reached more than 300,000 people, and there were more than 100 media hits as we continued to share the list of participating restaurants generated by Visit Orlando. Ironically, by the end of the day, there were exactly 407 participating restaurants listed on Visit Orlando's website. Our goal was to support our restaurants, but also to flood social media feeds with positivity at a time when there's been so much negativity. We did it. Some people criticize, well, you're sending a mixed message. You're saying leave your home. But no, we said with your mask and practicing social distancing, the restaurants still play a vital role in our overall food chain. Because of the schedule that I keep, I really depend on those restaurants to eat, like many of the other Orange County residents. One of our local restaurants, called Too Much Sauce, said it best through a tweet. Hashtag 407day gave them hope, which is what they needed during this time. And a local food blogger, Ricky Lee, suggested making this 407 day or days to support our restaurants all month long. So I invite all of you to join with us in making it hashtag 407 or 407 days. The president and CEO of Visit Orlando, George Argel, tells me that the restaurant industry employs nearly 120,000 people, or 10% of the total private employment in the Orlando market. He adds that our community is united. The restaurants report they saw an increase in sales and support from our community. Thank you to all of the Orange County residents who participated in yesterday's celebration and for supporting our local restaurants. Let me talk a little bit about an upcoming town hall meeting with WKMG. I know a lot of you at home have questions and concerns regarding our economy and the impact COVID-19 is having in our county. Tomorrow night, I would like to invite you to participate in a digital town hall. We are partnering with WKMG's website, clickorlando.com. Joining me at the town hall will be UCF economist Dr. Sean Snaith, Career Source CEO Pam Neighbors, and Tim Giuliani, CEO of Orlando Economic Partnership. We will be taking your questions and talk through solutions together. This is a very scary and uncertain time, and we want to hear your concerns. Next, in terms of our food chain, the Second Harvest Food Bank provides a significant benefit to the overall food chain, especially for the underserved in our community. The need for food is up 94% over the past 30 days. Our friends at the Second Harvest Food Bank report that the food bank's online searches for food have climbed from an average of 35 per day in early March to nearly 2,000 as of Friday, April the 3rd alone, and over 12,000 in the past 10 days. And in response, Second Harvest has roughly doubled its daily distribution of food to 300,000 meals a day. The team anticipates that number to rise as time goes on because we have so many of our businesses that are currently closed. As a nonprofit with limited budget and resources, Second Harvest relies heavily on the generosity of the community to help fund a long-term effort for those whose lives have been damaged by the COVID-19 pandemic. Financial donations are the best way to provide support right now. Second Harvest can turn a $1 donation into 4 meals. We've seen the community get involved with the Second Harvest virtual food drive tool. And for more information on how to help there, visit feed-hope-now-.org. feedhopenow.org. In the midst of this coronavirus pandemic, please don't forget to fill out your census forms. We ask that no matter where you live in Central Florida, while you are at home, take advantage of the extra time that you have and complete the questionnaire. Our census numbers play an important role in making sure that we can get federal funding for emergency management and response. So it's not too late to make sure your household is counted. For more information and to complete the questionnaire, please go to my2020census.gov, my2020census.gov. I want to thank you for staying at home and practicing social distancing when it is essential for you to venture out. Thank you to our teachers for working hard under these new conditions to educate our children and students. And I want to thank our essential workers that work in waste collection even, and utilities for keeping the power on and the trash removed from our neighborhoods. Let me also say thank you to some of our team of county employees that sometimes don't get mentioned, and that would be our Orange County Corrections personnel. Even while other businesses close, the Orange County Jail never closes. And the brave men and women who work there, they have worked to keep our inmates safe, and I'm happy to say to date, we don't have any inmates that have tested positive like many of the other correctional facilities. We do have a couple of correctional staff persons who have tested positive, but my hat goes off to those in corrections, the firefighters, law enforcement officers, healthcare workers, and the other team of people who are helping to keep our community safe. Thank you so much. Mayor Dyer.
Thank you, Mayor Demings. You know, every speaker at every one of these press conferences gets up and says, stay at home, keep your distance, 6 feet. And it may sound repetitive, but it's important. And the data shows that it's working. We're flattening the curve here in Orange County because our citizens are doing what they should be doing related to that. And we've been through a variety of experiences, from hurricanes to Pulse to now a pandemic. And what I've learned about communication during difficult times is it's important to be accurate, it's important to be concise, and it's important to be repetitive. So we probably will be a little repetitive up here, but it's important to keep emphasizing the message. So I have a little bit of a new look today. We all know that the actions that we're taking as individuals are critical to stop the spread and save lives. Each one of us has the ability to protect ourselves and our families, our friends, and that's why I'm wearing a cloth face covering. In addition to practicing social distancing, physical distancing, we know that there are people who are asymptomatic. That means they don't show any symptoms, but they still have the virus and they can pass that virus on. So one of the ways you can limit that is by wearing a cloth mask. You're doing as much to protect other people as you are to protect yourself when you're wearing one of these masks. This particular face covering was donated by Orlando Face Mask Strong, which is a group of 550 local volunteers led by the founder of Common Sewing, Bonnie Lewis. And every day they are making these types of masks to provide to our essential workers who are on the front lines of this pandemic. They're currently working on 65 that they're going to donate to OPD. So the city has donated to them reusable bags that were in our city stores. So I want to thank all of the volunteers for Orlando Face Mask Strong. And there are plenty of details on our websites and the federal website on how to make face coverings, but you can make them out of pretty much anything. Use old t-shirts or bandanas. So we are currently acquiring face covering for all of our City of Orlando employees whose job duties are essential that they continue to work in the field, and I encourage every Orlando resident to do the same. One additional benefit that I can tell you, I went to Publix yesterday wearing a hat and my mask, and not as many people recognized me in the store as they normally do. Staying home is still the best tool, and wearing a face mask can help others. Remember too, this is repetitive as well, wash your hands, clean frequently touched surfaces like podiums that other people are touching, and refrain from touching your face. If you can do that, that's how you spread it. I'm grateful to our residents and our businesses who continue to adjust in the ways they protect each other. We're continuing to make changes in our city programs and operations. We know that there are some folks that aren't physically distancing in a variety of activities, so we are closing our basketball and volleyball courts, taking down the rims and the nets, and our outdoor fitness stations at our city parks. The parks will remain open, and you are allowed to recreate there by running or jogging or walking as long as you're keeping the distance separation of 6 feet. This continues to be an unprecedented and challenging situation. We've asked a lot of our residents, but we're going to ask a lot more, and we have to continue what we're doing. The responsibility to get through this pandemic is on each and every one of us and the choices that we make. And the choice can be the difference between life and death for some of our residents. So in Orlando, we're resilient, we're strong, we'll make it through this because we're all going to take the responsible actions that we need. So thank you for everything that you do. Stay healthy, stay home, save lives. Thank you. Dr. Pino.
Good afternoon. I want to take this opportunity to thank our staff at the Florida Department of Health in Orange County. They have stepped up and served the community during this public health crisis. And they will continue to serve our community as long as we need to. They are in the frontiers of this pandemic, and from our testing sites, our case investigations, emergency management planning, and answering numerous phone calls that we have received during this period, I thank our staff for their dedication and efforts. And probably people don't know, but some of our staff have to go out into the community, find who was in contact with who, inform those individuals, and do these while these challenging times are happening, and also at the same time that their families are home. So for that, my gratitude. With regard to the testing, the mayor mentioned that we have 803 positive cases. That's a 9% of the and the positive rate that we are finding, and it has decreased from 10.4 to 9%. Now that could be a little bit of hopeful sign, but I don't want people to read too much into it because it could go up tomorrow on another day. But it's something that we are watching, and it's at least not going up for now, and that's important to highlight. The county has tested about 8,500 individuals in total, and we have over 7,000 negative tests. The median age continued to be 47, and we have, unfortunately, 2 additional deaths, a couple before yesterday. And those are the leading information that I have. I will share with you. Both individuals are 88 years old, one female, one male, and they are both white and not Hispanic. With that, I will answer any question that you may have after. Thank you.
It's all right. Good afternoon, and thank you. So I want to take a moment to update everyone on our deputies who have tested positive for COVID-19. So at this point, we had 2 additional deputies. So we have a total of 5 deputy sheriffs who have tested positive for COVID-19. They're all at home, isolated, and in good spirits. And I will echo that we thank the men and women of the Orange County Sheriff's Office and really all of Central Florida law enforcement. They cannot shelter in place. They cannot stay home. And unfortunately, although crime is down in Orange County since the virus struck us, there are still criminals out there that committing crimes and trying to take advantage of maybe not too many eyes and ears being out and about. So the men and women of the Orange County Sheriff's Office are working hard to keep all of you safe. But I want to ensure the residents that we're a very large agency. We have a good continuity of operations plan in place. Should more of our deputy sheriffs or any law enforcement agency in Central Florida be hit really hard with the virus. So we have plenty of law enforcement out there, and in fact, because schools are not in session, we actually have extra law enforcement out there in all of our jurisdictions. But that doesn't mean that we're still not patrolling our school campuses. I did want to let the community know that we do pay attention to those campuses, and we're aware that people may try and take advantage of that as well. So we're working hard to keep our entire community safe, including school campuses. And so we've all seen those news reports that may be positive and maybe trending in the right direction, but I will echo what's been said. Now is not the time to be complacent. We have to stay vigilant in the things that we keep repeating, as Mayor Dyer said, about stay at home. And I know we are, again, urging people to only go out unless they absolutely have to. And so and I will get off my high horse. I've been there before, stuck in the house on the weekend maybe, and wanting to go to the grocery store, but do I have to go? So that's where there's a difference between wanting to go out to the grocery store and having to go out to the grocery store. So we want everyone to stay at home, adhere to the orders that are in place, and not go out unless you absolutely have to. And so finally, as we are approaching Easter, again, I want to take time to remind our religious leaders that although the services are exempt by the executive order, we are strongly urging all of our religious leaders to practice good social distancing, do services online if they have those capabilities, or come up with some other ideas to maintain that safe distance and social distancing. I've talked to several pastors around town who have come up with some pretty innovative things, especially as we're approaching Good Friday and Easter, to maintain that safe distance while still being able to have their services and worship. So again, thanks to our community. I think we are doing a good job. We're still responding to some large gatherings of maybe people playing soccer or basketball. So we're asking that people please adhere to those guidelines, and we will show up to get that compliance. So please do call us if you see large gatherings or things that may be in violation of the order. Thank you. At this time, I'll turn it back over to Mayor Demings.
All right, thank you, Sheriff, and I'll open it up to some questions, but I will say that I joined Mayor Dyer. I have my face mask, and this one, I'm a graduate out of Florida State University, so it says FSU Seminole, so I've been wearing it most of the day, and it was a gift to me from the mother of one of our employees here in Orange County, so I do thank her, Mrs. Brinkley. If you're watching, thank you very much for my FSU face mask. And when I move about the building in most cases and go outside, I'm wearing a face mask. So I encourage our citizens to do the same. So with that, we'll open it up for any questions that you may have.
Hey, Mayor Demings, Jerry asking News 6. Do you all have the results back yet from that business damage assessment survey done by the state?
We do not have all of the results yet. We are optimistic that tomorrow or sometime this week we'll have that. I also look forward to getting a report about the surge capacity, the projections for our community from our hospital CEOs tomorrow morning. And so we will use those projections in making decisions as we go forward. Obviously, it's about the mitigation of the spread of the virus at this point, but at some point we will transition into that recovery phase of our operation, and it'll be instrumental to have the business community engage with us from the public sector. So it'll be a public-private response, and we'll be empaneling a team of individuals from our community to kind of help shepherd us at the appropriate time into a recovery mode that is a success for all of us. Okay.
Mayor Paul Rivera, West 2 News. Orange County Convention Center testing. What is being done specifically to make sure that supply remains steady? You said 350 secured today, right?
Yes.
What about the next day? What about after that?
Okay, the testing site is being managed and operated by the state through the Florida Department of Emergency Management. So it isn't being operated by the county itself. We are simply providing the facility. What the state has said to us, they are focused on keeping that facility open for testing for a myriad of people, and they've kind of reassured us through the Emergency Operations Center here within Orange County and the state's EOC that there will be an adequate supply of collection kits to support that effort going forward. Again, remember that that is a regional asset for the state. It's not just to be used by Orange County residents, but indeed by the entire region. Testing remains, I think, a priority for the governor, and it remains a priority for our community so that individuals who need to be tested can be tested.
Lauren Seabrook, Channel 9. Mayor, some health officials are comparing grocery stores to kind of a cruise ship environment because so many people are touching so many things. Today, the city of Miami is now requiring people, whether you're a customer or an employee, to wear a mask. Would you consider doing something like that here?
I have been in conversation with the Miami-Dade County Mayor. We are exploring those opportunities. I believe as our community looks at some point in the future to reopening businesses, it will take that type of thinking about what we must continue to do as a community, as a state, as a nation, to prevent, after a surge occurs, a secondary wave from occurring. So I think all of those types of things are what we will contemplate here. We're in a dialogue with our healthcare experts and other, I'm going to say, scientists around this effort as they endeavor to learn more about the virus and how it lives, how it can be transmitted. Each day there's something that comes out where we know a bit more. And so that is something that potentially could happen here in this community. Okay.
Mayor Demings, Renita Smith, I have a question. I heard you petition local businesses for services and manufacturing. We have submitted a proposal because we test the actual COVID testing, the respiratory panel. How soon do you plan? How soon is there red tape that has to be gone through? Like, what is the process? That's my question for you. Do you know? Can you get me in touch with someone?
Well, sometimes there are regulatory processes in place if you're producing a product that requires FDA, Food and Drug Administration approval. There's a process that you have to go through for those types of things. And then some of the other equipment requires other regulatory oversight. But I think there is certainly an entrepreneurial opportunity for many different types of businesses, because this pandemic is going to be impacting America for a while. It'll be impacting the globe for a while. So I just see that as an opportunity. If you're a business owner, if you're a visionary, is to think about that opportunity. While we try to have faith and confidence in the federal government and the state to provide for all of our needs, quite frankly, I don't know that they can, because of the magnitude of the challenge that we have. We've been trying that. We've been trying to get our equipment and supplies by depending more on the supply chain from the federal and the state level. And that hasn't worked as best as it could, I believe, for America. So why not look to a local perspective? If we can produce it here, and we can control our destinies a bit better, I believe. So I applaud your business. Depending upon what it is that you're producing and manufacturing, you would know better than I what those regulatory hurdles are. But I think the sooner you get after it, the sooner you will be able to sell your product and meet the demand for now and into the future.
Sam Sosa with Fox 35. Mayor Demings, the first part of my question is for you, and the second part of my question is for Dr. Pino.
Okay.
It's about recovery. The governor did talk a little bit today about reintroduction of tourism into our state. Has Orange County had those discussions about how you guys will reintroduce tourism and make sure tourists feel safe coming to our parks and coming to this area? And Dr. Pino, as we get over the peak and we're coming down, what do you recommend for people to stay safe on the individual level to make sure you're not getting sick even after this? How should people conduct themselves?
The discussions about reopening our tourist and theme park locations here, that's an ongoing conversation, again, as we all learn more about the virus itself. But let me say this to you. I believe that the fact that we have not realized some of the worst case scenario projections with the increase in cases is directly attributed to some of the decisions that were made here early on in this community, where the largest single site employer in America, Disney, made the decision to close. When you talk about 75+ million visitors coming here to this area, with the theme parks closing, I think that was a pivotal moment, and not just impeding the spread of the virus here, but across America and perhaps across the globe, because of the international nature of our tourism, as well as the domestic visitors that we have coming here. So I do applaud the major corporations with those single site employment centers to have done what they did. Truly, in that case, they put the people over profits. And if that had happened all across America, perhaps America wouldn't be in the position that it is in today. So I'll turn it over to Dr. Pino. Remember, if you have questions of Dr. Pino, ask him all while he's here.
So I would like to echo the mayor's comments. I really do believe that the early closures that we have in the county may have had a profound impact on how the epidemic is going to evolve here. So we will watch it and see how it goes, but I do agree that it may have had a really good impact. So we have to watch it. With your question, what is going to be the new normal after this pandemic pass? So I think it's safe to assume that we are going to have levels of these going on for a while, but it's going to be manageable. And we are not going to be rid of this until we have a vaccine. Short of that, we will have some levels going on in our communities, but because those are manageable, we are going to be able to prevent from other people from acquiring. What happens with the transmission of this barrier? For example, the flu, you normally transmit the disease to one person or two. That's how the flu spread. With this one, it's over 30 per each person that contract the disease. And that's why it's multiplied so fast. But I think that we are going to have to increase our habits of washing our hands, which we always have insisted on it. We may have to keep some social distancing, and the new normal may be a little bit different than what we are accustomed to. Thank you. Any other questions?
My question was actually for Mayor Demings.
Okay.
Sorry. Ryan Gillespie, Orlando.
There was, I'll respond, and then Dr. Pino,
sorry, I'm breaking your
you'll
rules,
be
man.
back. You're on deck because there's another question for you.
Sorry.
Okay.
When you look at this heat map, we've had it for a while, and a lot of the zip codes, just the numbers are climbing, but generally the same zip codes are the hot zip codes. Is there anything you've picked out in there that is concerning to you besides the numbers rising, or is there any kind of more specific plans yet on how to address those areas?
We're working with the Department of Health, with Dr. Pino's staff, because there's a lot of information that is HIPAA protected that we can't share about the demographics associated with those zip codes. What we intend to do is work with his office on targeting a certain health care response within those specific zip codes as we kind of identify some human experiences and interactions. It will allow us to maybe perfect messaging that's unique to a particular zip code or a healthcare response within that zip code. So that's something that we're learning more about now that more data is becoming available that is being provided by hospital systems and even the testing that Dr. Pino's office is doing in our East Orange location, and even that which we are taking in from the convention center testing site. If that makes sense to you. Okay. All right. So, Dr. Pino. Dr. Pino, these one more for me, and then we'll go to Dr. Pino.
One more for you, Mr. Mayor. This is Melissa Towns of Florida National News. I want to find out, do you have any additional updates or statistics regarding submissions to Orange County for the rental assistance program in terms of any updates for those who needed assistance?
Well, the update regarding the applications, we had, once we cleaned up the system in terms of the duplication of applications, we had some nearly 27,000. Our staff has gone through at least half of them at this point. That was the beginning of this morning. To evaluate them. So they're moving as quickly as they can. Yesterday we had a Board of County Commission meeting, and what we said during that meeting, we had allocated $1.8 million of our existing budget to provide assistance for rental assistance, and we're going to continue to do that. By the next Board of County Commission meeting, we'll have a better feel for how many of the individuals who applied met the criteria for receiving those funds, and the board will have to take a look at the county's overall fiscal health to make a decision whether we take additional funding to that or not. I will tell you a bit of good news is that we received as a county some notification of some funds that will be flowed directly under the CARES Act to the county to assist with housing that came from HUD that involves some community development block grant funds and other funds for housing assistance in addition to some funds that may be used for business assistance and other things. So our staff is trying to understand the dollars that will flow and how we will use those dollars for our entire community. So we're working through it is what I'm saying to you. We're more than 50% through at least processing the applications that we have received. Okay, and with that, I'll turn it over to Dr. Pino.
Pino, Curtis McLeod with Spectrum News 13. A question for you. Is the county currently monitoring individuals who have tested positive to see if they're actually self-isolating?
So it's a self-monitoring process. We had 800 people. It would be impossible to monitor all of them. Now, we establish contact when they are first diagnosed, giving guidance on what to do and how to do it. And now, we also have the legal tools to enforce isolation and quarantine. And if necessary, and if it comes to our attention that someone is violating what has been advised, we will not take it too kindly and execute those powers that we have.
Félix Pirela de Telemundo. Doctor Pino, estudios han revelado que cada 4 días se duplican las cifras de muertes acá en la Florida, y cito al Instituto de Evaluación de la Salud de la Universidad de Washington, que además es uno de los modelos que utiliza el equipo de trabajo del presidente Trump que está enfrentando esta pandemia. Ellos están proyectando que en la Florida, para el 19 de julio, habrá entre 3.600 y 11.200 muertes. ¿Cuáles son las proyecciones que tienen ustedes acá a nivel local?
I don't have real projections yet for the county. We are acquiring that talent next week, and so we will be able to do our own projections together with the hospitals. But when the mayor have that conference call with the hospitals on Friday, they probably will have more clarity on what the modeling of the hospital is indicating. Now, the state is also conducting modeling for counties. So, la pregunta fue ¿cuántas muertes estamos previendo que va a tener el county cuando llegue el momento más crítico de la pandemia? Y la respuesta es que en realidad yo no tengo la respuesta todavía. Estamos trabajando, hemos adquirido el talento para poder hacer este tipo de análisis en el condado. Y también el alcalde se va a reunir con los hospitales el próximo viernes, y eso nos daría una mejor idea de cuáles son las proyecciones. Hasta ahora, y no es que no tenga importancia, cada muerte de cualquier persona tiene importancia elevada para la persona, para la familia y para la comunidad. Pero los números, no que quiera yo traer mala suerte en este sentido, los números hasta ahora se están comportando en un parámetro adecuado para nosotros. Gracias.
Steve Hudak from the Orlando Sentinel. Dr. Pino, and could be for anybody actually, with all the challenges that the community faces with COVID-19, what is your greatest fear for the community right now?
So my greatest fear is for to have an outbreak in a closed environment, meaning an assisted living facility, a nursing home, a hospital itself, something that gets out of control. And this virus is invisible, and the role of asymptomatic people seems to be greater. And that's a challenge. Asymptomatic people, that's another challenge. People who don't feel sick and go all about their community and their normal lives, although they shouldn't, many people do, and while doing that, spreading the virus. And that's why it's important to, no matter what your hint is with regard to you have it or don't have it, or someone in your family have it, assume that everyone has it, assume that you have it, and protect yourself and protect others. Because there are a number of people, there is a percentage of people that will spread the virus without having any symptoms.
One more question, please.
Lauren Seabrook, Channel 9. Dr. Pino, in regards to the zip codes, have you been able to narrow down the demographics of those zip codes? And also, do you know how some of the people in these zip codes got it? And are they Is it one person or two people that have spread it to everyone else in that area?
The last question is difficult when you come to wide distribution in the community, sometimes to pinpoint where people acquire. Less and less we have been able to identify where people acquire. And that's part of the wide distribution of the disease. People are walking and they may touch a surface, acquiring the surface, and you cannot establish that connection. So that's happening less and less. The characteristic of each community. So I was talking to Ryan from Orlando Sentinel, and he brought to my attention a point. We may do some analysis on that. What is the population density on those zip codes? Are the zip codes that are getting the most cases also the zip codes where we have the highest population density? So that's another interesting. And Ryan was mentioning also, it has to do with socioeconomics. And, maybe the density, the population density has also to do with socioeconomics, how much space you have around you. And that's important, and we will have to look at it. Thank you.
Okay, thank you for being here, and to our Spanish-speaking media, muchas gracias y Dios los bendiga.